joined right now by our special guest, Ashley Langeliers. Am I saying it right now?
Yes, you are.
I was doing more of a Stephen King novel with your last name. Because isn't there a book, Langeliers?
Yes, they're like these time-eating zombies or something horrible.
And that is not her. So so Langeliers. Okay, and you are the clinical manager of the Center for Autism and Related Disorders Fresno office.
Correct.
In Fresno, California. But you're going to be here in Los Angeles a couple of days a week, and so I met her in the hallway and said, you have to come in, we'll have to get you on the show. And in particular, we were talking about different topics, because we're going to have you back again to talk about other things, but I threw a couple of topics at you, and what's fascinating to me here always is what you guys get excited about.
Yeah.
Because I don't have a background in autism, and to see you guys get excited to talk about something and that you're passionate about that is always astounding to me. But one of the things that I mentioned to her was, one of the things I want to talk about is working with older kids. That a lot of you guys write in and say, my child's 10, my child's 15, is ABA, and I always say, yes, it's going to be effective at creating progress, do this, but wonderful to have somebody that you do this on a regular basis. You work with kids that are older to talk with our parents about what that's like. So let's take the scenario first. Kids who have never had ABA before, so the parents are completely unfamiliar with it, anywhere from 8 to 10 to 15, boys, girls. You've done this.
Yes.
Talk to them about how exciting it is and the progress that you see and some considerations that they want to think about.
Sure. Well, I think in the Fresno office especially, we were just, lucky to kind of right off the bat when we opened the office get a lot of referrals for some older kids. So it's something that we definitely have a lot of experience with there. And as you know, CARD has their 2 curriculums. There's the CARD 1 curriculum that's designed for children basically like birth to 8, and then 8 to 21 falls under the CARD 2 curriculum. So we have both of those things. And I think when you get an older child, at least for me, getting an older child who's never had ABA coming in, it just seems like a much bigger, almost like puzzle right away. Because if I get like a 2-year-old in, it's like, okay, these are all the skills that a 2-year-old needs to know.
Right.
And obviously there's a ton of them, but it's really not a lot compared to the list of something that a 10-year-old or a 12-year-old child needs to know.
Right.
So I think the assessment process for a child who is older, around the ages of 10 or 12 or 15, it takes a little bit longer. I feel like it's a lot more in depth in terms of finding out exactly where the delays are in what specific areas and really how we need to program to best benefit the child.
We talk about Swiss cheese a lot here. That I'm always saying, because I used to teach, and in the classroom, kids come in the classroom and they're like Swiss cheese. They have one skill, but they're missing a skill here. Even typical kids.
Yes.
And how the older they get, the more possibility for holes in the cheese.
Yes.
And so I would imagine it does take longer. You've got to figure out exactly where the holes are. But what I love about that is you're not just assuming.
Right.
And going, okay, well, here's the autism assembly line. We have a child who's 12, so, here are the lessons.
Right.
Because it's not one size fits all.
Yeah.
So the assessment tells us where the holes are that have to be plugged.
Definitely. And I mean, we have an assessment center here at the corporate office that can travel to and do assessments at the local offices. And I think that assessments are helpful regardless of the child, but especially I think for an older child, getting kind of like an in-depth language assessment, getting an in-depth cognitive assessment, and really getting a lot of information regarding basic language concepts, pragmatic language, social language, because a lot of the times a child might come in who's on the spectrum like 10 or 12, and if they've never had ABA, chances are maybe they're a little bit like higher functioning. They might just have more delays in specifically like social skills or social pragmatic language, things like that. Maybe that the parents, it's unfortunate that a lot of parents, I actually had a client's mother tell me when asked, I think maybe by the funding source, like, well, why did you never get ABA for him before? And she said, well, I was told that it was for severe behaviors, or it was for if my child was like tantruming or all the time or hitting me. And she said, he never did any of that. He was very kind of like just a laid back kid, but still has like very, very significant language delay. So, it was, we've actually gotten a lot of these clients through a social skills group that we run. And so we've gotten a lot of these kids where their parents are like, wow, this social skills group is doing some good stuff for them 1 hour a week. And it's kind of like, well, hey, you think that's good? Like,
what would happen if we could really expand on this?
Exactly. Yeah. So,
and you do that all the time.
Yes.
Work with those kids. Let's talk a little bit in terms of, so once they get the assessment, then who decides what the appropriate amount of hours is? Is it the funding source usually, or is it you guys? What does it depend?
Well, we will always give, if we do an intake assessment for ABA, we'll always give an hour recommendation, a very honest recommendation about what the best number of hours would be for this child. Whether or not the funding agency accepts that, is a different story. But the exciting thing more recently has been with like the insurance mandate in California. We've gotten a lot of older kids, who are in their teens, and if a 20-hour program a week is recommended and we can show that they can make progress, we have kids that are getting that type of intervention and at that intensity, which is amazing.
And how old, basically, in terms of what you guys experience? Because I know it's what comes to you, but like, what's the oldest child that has come in? Are you getting kids that are 17, 18?
Yeah, I have a 20-year-old right now.
Okay. Mm-hmm. Okay. Fascinating.
Yeah.
And it's going to be different. Like, it's not as if it's, again, not cookie cutter. So the 20-year-old comes in. It's not as if you say, okay, well, 20-year-old gets 8 hours. You make a recommendation based on exactly where that individual is at this period in time.
Exactly.
So important for parents that to make sure that you have somebody who is going to, and I love that about CARD, because you guys always do. I hear this from parents over and over and over, that you make the recommendation for what the child is. It is not always accepted by the funding source.
Yes, very frequently.
It's a big reality, but in the mix as a parent, you don't know.
Yeah.
Like, if I were going to have to say what my child needed, good luck to all of us, because I have no idea, and nobody's going to listen to me anyway. And so you go to the school or you go to somebody and they make a recommendation, and a lot of times as a parent, you don't know whether that's accurate. And I do love that about CARD, that and we don't hear that from everybody, that there are some places that try to cater what they list into realistic terms of what the provider will give.
Right.
And I think that's not productive for anyone.
Right.
That's not productive for the family. It's not productive for the parents. It's not productive for the funding provider. I understand they don't have enough money to do everything that they have to do, but let's not pretend that it's the same thing. Mm-hmm. A doctor doesn't write a prescription for the medicine that you can afford.
Right.
The doctor writes the prescription for the medicine you need, and if you get to the pharmacy and you can't afford it, you work something out.
Right.
And you make choices, and you walk away with the knowledge, I didn't get all the medicine I needed.
Right.
And we need to be treated as parents that way, and we need to step up on a regular basis and say, don't tell me something that's not the truth.
Absolutely. I mean, I think, and then you end up with these parents or these kids in just like these terrible situations, especially now with the insurance mandate, but maybe a child who was getting funding through like a regional center or something like that, and a kind of like a generic recommendation was written in for like what maybe they knew that the funding center would authorize.
Right.
And then that report, once insurance takes over, it gets sent over, and you can't really say, oh no, I was just kidding about that recommendation, you know, because they're documents. They're going to follow the kid.
Absolutely.